Welcome back. And if you're looking for tennis, you can find it over on our sister station, MyNDY Channel 23. Now, if you caught our new show, The Doctors, at 4 o'clock today on 24-Hour News 8, then you may have seen the segment on the facelift. It was sort of the end of the hour. Well, for patients not ready for the full surgery, there are alternatives. And we have an update now on a wrinkle filler that we first reported on a year ago. If you want to get rid of wrinkles, never fear. There are products galore that are available. The latest and greatest, Artefill, which is a combination of cow collagen and tiny plastic microspheres. About a year ago, Dr. Mark Hamilton spoke with 24-Hour News 8 about the product.
And I really insist that they do the temporary filler first.
Along with Dr. Hamilton, we also checked with another plastic surgeon on Artefill. He was skeptical and wouldn't recommend it. But now, 1 year later, Dr. Hamilton is pointing to the latest 5-year study on that wrinkle filler. And he says the news is even better. The microspheres used to puff up the wrinkles are smoother, more regular, and less prone to cause a reaction.
This is the version used in the U.S., and you'll see that they're much more uniform in shape and a lack of particles.
These little spheres are injected under the skin. Older versions of Artefill were more irregular, and you could even find tiny particles in it. There was more of a chance of a reaction. But Dr. Hamilton says his patients have not had any problems and have been happy with their results. But there's always the more radical technique, a face and neck lift.
So most of the lifting was done inside to get the neck up, to eliminate the nasolabial lines.
Unlike a facelift, Artefill is done in a matter of minutes, and it's much less invasive. And Dr. Hamilton believes it's safe.
And it's really showing a good track record. Still a good safety profile. When you compare it to the temporary fillers, I think it really holds up very well. And the product is still there 5 years later, which confirms what we expected, that it's a long-term, if not permanent, change.
Actually, Artefill has been used around the world, Europe and Canada, for the past 20 years. But the product is made by different companies around the world. Dr. Hamilton says the American product is the best.